So good evening, everybody. We have reached the end of our vaccine week, day 5, Friday. A pleasure again to be with you all. My name is Manuel Castañeda, Director of Community Health at New Brunswick Tomorrow. And as always, I have my co-facilitator, partner and friend, Maria Merced, who is the Director of Community Health for the Health Promotions Program at Robert Wood Johnson University Hospital. Last day, and I think I did it perfect that day in terms of not messing up your title there, Mariam.
Good evening. Thank you, Manuel. We're very excited to be here today in this final day of our vaccine week number 2. It's been quite a journey to talk to many of our physicians in the area about vaccines and the new information that's coming out. We want to remind our listeners that these are trusted sites that you can come for information in Su Salud and Live Well, and that you will find here the updated information that is needed for you and your family to make the best decisions about getting a vaccine, the COVID-19 vaccine.
Yep, absolutely. And much like we did with part 1 and now part 2, if there is a need for part 3, let's knock on wood and hope that there is no need for part 3. But if there is a need for part 3, know that we are committed to you as residents here of New Brunswick and the New Brunswick area, that we will do, and continue to provide these type of important information updates for you as you make your decisions around COVID and getting the vaccine. But let's get into the actual focus of the day. We have a great presenter today, someone who's been in the community for quite some time. We're going to be addressing, just so that people know, COVID-19 myths and disinformation. Unfortunately, social media is a good and a bad thing. There's unfortunately a lot of misinformation or wrong information that is being displayed on social media that just people are hearing. And we want to make sure in this segment that we address some of those major areas of disinformation that we continue to hear, so that you do have the accurate information, right? That you at least are making decisions based on what is the right information, as opposed to information that is false or misleading. And who better than Dr. Jahn? So Mariam, why don't you take the honors of introducing Dr. Jahn to our discussion.
So I'm very happy to introduce the speaker for today. I have known Dr. Jahn for a number of years, and we have worked in many initiatives around New Brunswick. And he, better than anybody else, knows about misinformation as he treats patients, and the kind of resources that we need to provide for our residents to have better access to care and health information. So Dr. Eric Jahn is the Senior Associate Dean for Community Health at Rutgers Robert Wood Johnson Medical School. And welcome, Dr. Jahn.
Welcome, Dr.
Thank you, Mariam. Good evening, Manny and Mariam. It's a pleasure to be here. Thank you for having me.
Thank you, John. And I've worked with you for years as well now, so I know fully well, your commitment to the community and your touch to the community. But just for everybody that's listening in, what is your connection to New Brunswick, if you don't mind that?
So I've been working at the medical school, Robert Wood Johnson Medical School, since 1992. And throughout that time, though I've had a variety of roles, I have consistently been caring for patients at the Eric B. Chandler Health Center, which is a federally qualified community health center operated by the medical school and the Eric B. Chandler Community Board. I'm a general internist by training, so I see adult patients, and I've been in practice continuously there since September of 1992.
So it's fair to say that you've seen your fair, or that you actually continue to see your fair share of New Brunswick residents as patients.
Yes, absolutely correct, Manny. Thank you.
Great. So let's get into this. Let's get into the myths and disinformations. You're our myth buster today, Dr. Jahn. And we'll start with just major myths that we've been hearing out in the community, right? And at least be able to discuss that so that people get the right information. Starting with the vaccines, we still hear a lot of people that are concerned because they say that they've heard that it affects your DNA, right? That if you get especially the mRNA vaccines, right? The Pfizer, the Moderna, that if you were to get injected with those vaccines, that it would alter your DNA and cause problems. Is that correct? Is that something that people should be afraid of?
Absolutely not. Yes, it is a prevalent misunderstanding or myth. The vaccines that we utilize do not interact with your DNA in any way. The vaccines that we utilize have different ways of stimulating your immune system so that you're prepared to fight the COVID infection should you be exposed. But none of the vaccines, including the mRNA vaccine, can enter into the nucleus of your cell to interact with your DNA. And your DNA is in the nucleus of your cells. Where they work is in different places. And what we ask vaccines to do is to prepare your immune system to fight infection.
Great, thank you.
One of the biggest things that we hear out in the community as we have been doing outreach and knocking on doors to make sure that people have the information of where to get the vaccine is that they are injecting you with COVID, that you're going to get COVID because they're injecting you with COVID.
Yeah. None of the vaccines that we use can give you COVID. They don't contain the live virus. And they work by stimulating your immune system to recognize what's called the spike protein, which is a part of the COVID virus. So they cannot give you COVID. That is simply untrue and not possible.
Thank you for clarifying that.
Going back to the mRNA, vaccine. So what we know as Pfizer and we know as Moderna. Another thing that we've been hearing a lot about is that we can't trust these vaccines because they're brand new. They haven't really been tested. We don't know what negative implications or things can happen down the long run. What is your response to someone who has this concern?
I think it's important to understand that even though the mRNA vaccines are new, the technology was actually being developed well prior to the COVID pandemic. The vaccines came online very quickly because we were in a public health emergency. But it's important to remember that no steps were skipped in terms of their development and evaluation. What was different was that many steps were taken simultaneously in order to bring the vaccines to availability more quickly. But the FDA, in reviewing the submissions from the developers, did not skip any steps in terms of reviewing data or what was being asked of them. And what we were asking the vaccines to do to prove that they were effective and safe was set before the vaccine started to be developed. So it wasn't something where, this looks like it's okay. There were clear guidelines of safety and how effective they were going to be that the manufacturers had to demonstrate they had achieved.
Yeah,
I think that one of the, I'm sorry.
No, go right ahead, Mary.
I think that one of the good things that we need to clarify in this process is that all the information that you are giving us and that has been given by trusted resources based on science, is based on data. As they have tracked so many people that have been vaccinated. That's the information that we're getting. Can you talk a little bit about that?
Yeah, so Mariam, you're absolutely correct. There is really a very robust tracking and accountability around these vaccines, ability for people to report bad outcomes or suspected bad outcomes into a vaccine reporting site that's being analyzed and looked at all the time. And, when there have been, people may remember when there were concerns about the Johnson & Johnson Janssen vaccine actually was paused, was paused for a short period of time, why those were evaluated. So yes, there is ongoing surveillance that is very complete and important.
Yeah, I think two things to stress that you've mentioned, Dr. Jahn, that I think it's very important to emphasize is one, that this mRNA technology, right? So is not new, right? I think it's over 10 years old, if not more. So that the actual yes, the actual vaccines are new, but that the technology used to create them is not. So that people with this notion that it was just, that it just appeared out of thin air, that's not necessarily the truth. And then number two, to Marion's point is the science, right? And really making sure that you're getting your information from trusted sources, I think is key. Another area another thing that we hear with the COVID vaccines from the community is there are people that are concerned and that have heard that you can get that you're actually getting microchipped, right? That the government is microchipping you when they give you the vaccine. Is there any truth to that? Is that even possible?
No, there's no truth to it. The vaccines were developed to prevent you from getting COVID. And there is no heavy metal, no magnets, nothing in the vaccines that could be used to track an individual. So that is an untruth.
Right. Yeah, going around the same line, in addition to the microchipping question, some people are just saying that they feel that the ingredients in the vaccine are harmful. So kind of, in the same lines. Now, from what I understand, and you can correct me if I'm wrong, it's very basic what's in this vaccine, but maybe if you can explain that a bit more.
Yeah, if people would like to see what's actually in the vaccines, the CDC website actually lists the ingredients that's in all the available vaccines by name, and you can see them. I think the important thing is things that people often worry about are things like eggs, gelatin, latex, other preservatives. The vaccines do not have those in them. And they're free of metals. So I'm comfortable saying that they're safe and effective and do not contain anything that people should be worried about, other ingredients that I listed previously.
Great.
I think that the other issue that we have seen a lot and heard a lot is about that the vaccine, they just don't work, right? And now that it's recommended that we get a booster, it's like people reaffirming that like, oh, it didn't work. Now you have to get another shot. So can you talk a little bit about the effectiveness?
Yeah, it's a really good question. And when I'm speaking to my patients who raise this with me, what I emphasize is, in going back to the science, Mariam and Manny, as you guys have discussed, it's clear that these vaccines prevent severe illness, hospitalization. As more and more people get vaccinated, we are going to see breakthrough infections. Because more and more of the population is vaccinated and no vaccine is 100% effective. But you are less likely to get sick. You are less likely to end up in the hospital if you have been vaccinated, and that is clear from the science. It is also becoming clear that our immunity that's generated by being vaccinated decreases over time. And that's true whether it was immunity that we developed because you had COVID or because you were vaccinated. And since that's becoming clear, the push now is for people who have completed the primary series to get an additional shot, an additional immunization called a booster. That's different than some people who were suggested to get a third dose. This booster means we are boosting your immunity that you developed either because of having previously had a COVID infection or being immunized. Yes, no, it is not a sign that the vaccines aren't working. It's clear from the science that the vaccines do work, breakthrough infections are to be expected, unfortunately.
Dr.
And
Jahn, I was
we
just
have
gonna,
seen from the numbers, right? I'm sorry, Manuel. We have
all
seen
right.
from the numbers that the people getting infected now are people that have not gotten the vaccine, the highest.
That's correct. That people who are ending up in the hospital now, a much higher proportion of those are not immunized.
And Dr. Jahn, so we talked about, the boosters and having to get continual shots, but this isn't just unique to COVID, correct? I mean, if we look at other vaccines, they kind of follow this same track, correct?
Yeah, viruses change over time. And also vaccines against virus may require occasional boosting. So you're correct. None of this is unexpected. And I think we will be managing COVID for quite some time. So this is, when I chat with patients, it's like, stay tuned. Here are my recommendations now. And, as they evolve, let's stay on top of this together. Right now, the best protection we have against people getting COVID and getting sick from COVID is to get the first shots, what we call the primary series, to get boosted when it's time for you to get boosted, and to wear masks. Those are the tools we have to prevent this disease from affecting ourselves, our families, and our communities.
Dr. Jahn, a similar question to, people saying that the vaccines don't work because you have to get repeated shots, and I think you've covered that well, is that it doesn't work because we have variants, right? I know that the Delta variant is the most prominent at this point, and I know that people have been hearing about this new Omicron variant, but at least from what we know about the science today, do the vaccines, are they effective with the known variants that we have around COVID-19?
Certainly for Delta, yes, we find that they decrease your chance of getting very sick from COVID and ending in the hospital. The data around Omicron, I think, is evolving, and by the time of this broadcast, we may actually have more information. Again, I go back to what do we know right now and what can we do as individuals in a community right now. It's to get vaccinated if you haven't been vaccinated. It's to get boosted if it's time for you to get boosted, and it's to wear a mask. There may be additional needs for boosting based on Omicron. We just don't know that yet. This is, since we've been in the COVID pandemic, it's been an evolving, changing set of recommendations about what we can do to keep ourselves well and our community well. And I think we just, as individuals and as a community, need to be prepared to continue to think about it that way. And as much as we hope it will totally go away, that may not be a realistic expectation, and we have to be prepared to keep managing this.
Another similar question is the side effects, right? That's another thing that we're hearing. Yes, some people have experienced side effects, and some people have interpreted that or taken that to mean that, oh, there's side effects, that means that this is not effective, that this actually gets you sick. Is that the case, or is, what's the deal with the side effects?
Yeah, so I think the other part of your question is, should I worry if I didn't have side effects? Because often what we say to folks, which is true, is that the side effects of the sore arm and feeling tired and achy, which are maybe headaches, which can happen a day or 2, 3 after you've had the immunization, are a sign that your immune system is working. And that's true. However, it's not true that if you didn't experience them, you should worry that you didn't have a response to the vaccine. Even if you don't have those side effects, the vaccine's working inside your body to give you immunity against COVID.
Yeah, and I tell people, I got COVID last September before the vaccines were available, and it was the best way I can describe it is 2.5 weeks of hell. Given the choice between suffering side effects for 1 to 2 days or going through what I did, there's no question in my mind that I would take the side effects any day. So I think it's just something that from my own personal experience, I wanted to share with people.
Thank you, Manny. I think those stories are really important to share. I think it's very natural to have a fear of new things, to have a fear of something that may make you not feel 100%. But again, I go back to what can we do as individuals and a community to stay well right now? And the science is clear. Get immunized, get boosted, and wear masks. And I can't come back to that enough.
And I also, we have to remind ourselves that, COVID created a lot of fear in our communities, right? And pain, real pain of lost individuals in our communities. And like you said before, this is what we have at this time to protect ourselves. Can you talk a little bit about using the mask after you get vaccinated? That's another big question that we get all the time.
Yeah. So because there can be breakthrough infections when you're immunized, and because especially with variants, we're not sure how the vaccines may work against transmitting it. If you have a low-grade infection or an asymptomatic infection, it is important to continue to follow the mask guidance. And in areas of high transmission, which we are in New Jersey right now, it is recommended to be masked in indoor settings. And I concur with that. We wear masks when we're seeing our patients. We wear masks when we're at work and in group meetings. And they're effective. Even though we've been immunized, I continue to ask my patients or suggest for their health and the benefit of their families to be masked indoors, in public indoors. I'm not talking about home around people who are, who are your usual contacts, but in group settings, I continue to wear masks myself, and I recommend it for my patients.
Especially now that we are entering into the winter month and all the activities are indoor, the holidays are around the corner. So we have to make sure that we're protecting our residents and our families.
Yeah, I agree. And I think the other thing that's important is, if people haven't done it yet, is to get immunized against an influenza, the flu shot. That is the other way to stay well this winter. We had mild influenza season last year, perhaps because of all the social restrictions, but so much of that has been eased. It's important that you protect yourself against the flu as well. The way to do that is to immunize, to take a flu shot.
And again, we can do them together.
Yeah, you can. You can. Really, the only potential downside of that is if you're having side effects, you may not know which vaccine gave it to you, but they can be given at the same time. And certainly, and we didn't do that early on when we were immunizing. It's a good point to go back to, Mariam, that initially we were trying to separate COVID vaccine from flu vaccine by 2 weeks. But that has been removed, and it's fine to get them close together simultaneously.
Right. Another question that we get, Dr. Jahn, are for those people that got COVID, right? That said, well, I got COVID, so I don't need the vaccine. I already got natural immunity. What's your answer to that?
Unfortunately, it's not true. And so you need this primary series, and you need to be boosted. It's very clear that people can have had clinically been had COVID and then get it again. So, and the immunizations are the tool to fight that from happening. So if you've had COVID, you should get your primary series, and you should get boosted when it's time.
Similarly, a question is about children, right? And the fact that for better or for worse, right? You know, the majority of children that have gotten COVID, they're mild cases. At least that's what we're hearing. Although we had, a doctor on Wednesday state to us that they're seeing an increase of children being hospitalized. But let's go with, what people have been hearing, right? That children would generally just get mild cases and that they can get over that. So there's no need to get children vaccinated. What would you say to someone who's thinking in that way?
Kids can get very sick with COVID.
Yeah.
It happens. And the way we can prevent that is by immunizing children when their age group has been approved to receive the vaccines. The other thing is our children are in group settings, schools, and we would, if we can interrupt transmission using vaccines, that could be very important in terms of limiting what's happening, and also bringing it home to other family members who may be, at risk for more severe complications. So I know earlier in the week you talked to some of the pediatricians about immunizing kids, but when children are eligible, I believe it's best medicine that they get immunized.
I think
and relying on natural infection is not a good way forward.
Right. And I think something that you sort of have touched on that was emphasized by other doctors, and I really think that it's important to bring out here, is that vaccinating somebody or getting vaccinated is not just about the person, right? It's not just about protecting the person, but to your point, it's protecting the loved ones or your family members or your community, people that you're in contact with that might not be able to get the vaccine for medical reasons, right? Whether they don't qualify for the vaccine. So any child under 5 at this point, right, would be without the vaccine. People with immune issues or some other type of conditions. And so I think that's an important, point to stress, right? That people need to not just think about, this is me, I'm fine, but understand that you're also doing this for everybody else.
It's a very fair point, Manny. Again, I go back to talk, how do we think about this? And I tend to think about what are the tools that we have right now to make you and your family and your community healthy. And it's clear to me that those tools are the vaccines and masking. And so that's just my advice.
I also think that for many people that want to hear this information, understands and believe that this is the way to go, sometimes implementing that in a larger family is kind of difficult, right? My past Thanksgiving at my house used to be a large Thanksgiving. Now it was limited to those that were vaccinated, that didn't have any symptoms. And I know that some people got offended, but I am responsible for an 88-year-old dad that lives with me, and he is my responsibility. And I had to explain to people, I don't have anything against you. It's not a political thing. It's just a health, measure that I had to take to protect my dad.
I think we've all experienced severe disruptions into our normal interactions with our community, with our families. I think your example, Mariam, is a perfect one of some of the difficult conversations that have been forced on us. I think, in my professional opinion, you made a wise decision in terms of how you handled that situation. And again, I go back to your preface before, as we started our conversation. This isn't about politics. This is about science and what we know. To me, that's clear.
Yep, and just to emphasize your point, really, Dr. Jahn, right? It is important to get the vaccine, right? To follow the series, your first, second dose, if you go with with the Pfizer or Moderna, the one dose if you go with the Johnson & Johnson, but that you also get boosted when it's your time to get boosted. And wear masks, right?
And wear masks, yes.
Great. Dr. Jahn, thank you so much. We're going to switch a bit of the topic because the rest of what we're going to cover is actually, now that we've given a lot of information on the vaccine, we hope that people have been listening to us, this whole week. We hope that we've provided accurate information. And for those that are already at a point where they're seeking the vaccine, right? We just want to let them know that the vaccine is available locally here in New Brunswick. And so I'm going to share my screen real quick. Can everybody see that? Yep.
Yeah.
Okay. So thank you. It's hard because I can't see it. Okay. So, this is something from the Live Well Be Bien New Brunswick Facebook page. And we do this and we update this as we get information with respect to places that you can go to get your vaccine. These ones that are listed that you see on the screen are the ones that are stable places that you can go with set schedules. And so we know that the Middlesex County Office of Health Services does various places where they provide the vaccines. Eric B. Chandler Health Center, which Dr. Jahn, you're affiliated with, also provides a good amount of times and days to get the vaccine. And the magic number is listed here, but I'm going to make sure that people know it. If you need a vaccine, you can call Chandler 732-235-6733 and set that appointment. So know that that's available. But in addition to there's one for Rutgers for the School of Pharmacy for the Rutgers students that are listening to us. And they also see, New Brunswick residents as well. So it's very important to say that you have a lot of, opportunities to get vaccinated. In addition to these set places, a lot of, our healthcare partners, a lot of our community-based partners, faith-based partners, the school district have created what we call pop-up clinics in the community, right? So they try to go in different places in New Brunswick and try to make the vaccine accessible to those people in that area so it's easier for them to get it. For example, tomorrow, there's going to be a vaccine clinic at Redshaw School on Livingston Ave from 10 to 2, and they're open to the public. So if you need your first dose, second dose, booster, all are available and open to the public. So again, continue to check out Live Well Be Bien New Brunswick Facebook page. I know, Mariam, you also put the same information out for people to know in Su Salud. And so we ask that you look at this. If there's any questions, we really do make sure and try to make sure that people are aware of all these opportunities that are available to them.
And they have available not only for adults, also for children. Both hospitals are doing, at the Children's Hospital and St. Peter's, they're doing vaccines for children. And our local pharmacies also have been very active in providing vaccines in New Brunswick, and pharmacies around New Brunswick. They've been very active. And I just want to remind everyone that vaccines are free, right? The government provides the vaccine. They do ask you if you have insurance, because the insurance can pay for, I don't know, the alcohol wipe that they use on you, but the actual vaccine is free.
Great. Well, Mariam, Dr. Jahn, we have reached the end of our series. Mariam, this is it. We've made it to day 5. And so I want to take the opportunity first to thank Dr. Jahn for ending on a great presentation. I think very important to address these myths and disinformation that we had, and want to take the opportunity to thank you. But I also at this want to take this opportunity to thank all the other partners that participated in Vaccine Week. So starting with the NAACP, Mariam, Robert Wood Johnson University Hospital, not only for your continued participation, but you personally for helping us, and as always, co-facilitate Vaccine Week. Thank you so much. Healthier Middlesex, the networks there, the networks at Healthier New Brunswick, all our partners there. Definitely want to recognize the Rutgers Robert Wood Johnson Medical School, Rutgers Eric B. Chandler Health Center, the Rutgers Global Health Institute, the Rutgers Institute for Healthcare Policy and Aging Research, and the New Jersey Black Women's Physicians Association. Those were special shout outs for, especially with the presenters that we had. And so thank you all for the time and the effort to create Vaccine Week. And thank you for, like I said, all of our community partners that are supporting this in different ways and making sure that the information goes out there. So a major thanks to everybody. And
I just want to close out.
Yeah,
close out by saying thank you, Dr. Jahn, and thank you for the work that the Eric B. Chandler has been doing in our community for so many years, but especially during this health crisis, when we weren't out there knocking on doors. It was so great to hear that people were already vaccinated at Chandler, that they had already gotten a call saying, oh, my doctor has my vaccine at Chandler. I'm going next week. I think it's important to know that our communities trust their physicians, trust their health center, and thank you for that work.
You're very welcome. I'll say thank you for that compliment on behalf of Chandler. And I want to give a thank you to you guys for helping facilitate good information and being a trusted source for people to go. We've accomplished a lot as a community during this crisis, I believe, but I think a lot of that has been in the immunization area. So thank you to both of you and your organizations and all the partners you mentioned, Manuel, who have helped in this effort.
Thank you, Dr. Jahn. That was appreciated. So on behalf of New Brunswick Tomorrow, Live Well, Revere Beyond New Brunswick, we wish everybody a safe and healthy holiday, and stay tuned. We'll continue to provide accurate information as we get it. Have a great night, everyone.